We're all getting older, and getting an annual physical is a good way to screen for some prevention. For the people who have medical conditions who've seen doctors, those are good times to recheck and see what the last year's been and where you want to plan for the next year. For the people that have never been to the doctor, it's a good idea. Annual physicals nowadays take on a new flavor because now we have computers based with our medicine. So once you get through your registration process, we'll check you out, we'll check your weight, we'll check your vital signs, we'll calculate your BMI, which is a measurement of your mass index, which people are using and companies are using to see who's fit and who's healthy. You visit with your doctor, you go through the basic things like you would have gone through, and if your last visit it wasn't since you've seen your pediatrician, it's basically the eyes, the head, the ears, the heart, the lungs, the belly check your reflexes using the hammer. And then it's lab work. For adults, we diagnose a lot of conditions by lab work. We do a lot of screening blood tests. We'll be checking your blood count for anemia, and we'll look at your chemistry to look at your sodium and your potassium levels. We look at kidney function and liver functions. We'll look at that all-important cholesterol number because that is beaten into our heads that having a low cholesterol is what's healthy, and it is. We will do a cardiogram, we'll check your urine test, and then we'll decide upon other tests or other therapies based on this. It's good to know these things. It's good to figure out what's going on your insides, because a lot of times you don't feel bad until it's almost too late. You don't want to wind up in the emergency room with a heart attack if it's something preventable, or diabetes, or something that the emergency rooms are great, but they can't help you give a continuity. They can't tell you what's going to happen for the rest of your life. That's what a physical really is designed to do. Family history is essential to know about prevention because it comes down to genetics. Many of these diseases are inherited genetically. Diabetes, high blood pressure, heart disease, heart attack, stroke, cancers are all genetic diseases. We learn about these things as the technology's gotten better, and we can talk about prevention. We may not be able to change your genetic imprint, but we can learn what happens together when you come in to talk about them. And this way we can stratify your risk to help identify these things. Medications are targeted to help people for their conditions, to help reduce your risk of sustaining a morbidity, an issue with a heart attack or a stroke. But if it's out there in your family and you have everybody in the family has high cholesterol, and they've all had bypass surgery, and they've all had vascular surgery, you can be sure that the tree will shake out the same. And the idea is to come in when you're younger, when you want the prevention, and learn about what we can do to modify and identify the risk. The annual physical is a worthwhile investment. It lets you know that you're healthy, and it doesn't hurt. An annual physical will give you the information that you need, will give you your data, will give you a data set, will give you data points for you to look at, for you to discuss, and to come back the next year, and the year after, and the year after. And coming in every year builds a relationship, and from the relationship, you both move forward.